Welcome to HDL, the good cholesterol, explained, from the experts. A video from the NASH Facts project, an organization committed to bringing you expert information from trusted sources about fatty liver disease and NASH. Enjoy the quick guide to HDL, the good cholesterol, based on expert health information from the National Library of Medicine. HDL, the good cholesterol, is also called high-density lipoprotein. What is cholesterol? Cholesterol is a waxy, fat-like substance that's found in all the cells in your body. Your liver makes cholesterol, and it is also in some foods, such as meat and dairy products. Your body needs some cholesterol to work properly, but having too much cholesterol in your blood raises your risk of coronary artery disease. What are HDL and LDL? HDL and LDL are two types of lipoproteins. They are a combination of fat, also called lipid, and protein. The lipids need to be attached to the proteins so they can move through the blood. HDL and LDL have different purposes. HDL stands for high-density lipoproteins. It is sometimes called the good cholesterol because it carries cholesterol from other parts of your body back to your liver. Your liver then removes the cholesterol from your body. LDL stands for low-density lipoproteins. It is sometimes called the bad cholesterol because a high LDL level leads to a buildup of cholesterol in your arteries. How do you know what your HDL level is? A blood test can measure your cholesterol levels, including HDL. When and how often you should get this test depends on your age, risk factors, and family history. The general recommendations for people who are age 19 or younger are: first, the first test should be between ages 9 to 11. Second, children should have the test again every 5 years. And third, some children may have this test starting at age 2, if there is a family history of high blood cholesterol, heart attack, or stroke. The general recommendations for people who are age 20 or older are: first, younger adults should have the test every 5 years. Second, men ages 45 to 65 and women ages 55 to 65 should have it every 1 to 2 years. What should your HDL level be? With HDL cholesterol, higher numbers are better, because a high HDL level can lower your risk for coronary artery disease and stroke. How high your HDL should be depends on your age and sex. Here is the breakdown. In Group 1, which is people age 19 or younger, a healthy HDL level is more than 45 mg per deciliter. In Group 2, which is men age 20 or older, a healthy HDL level is more than 40 mg per deciliter. And, finally, in Group 3, which is women age 20 or older, a healthy HDL level is more than 50 mg per deciliter. How can you raise your HDL level? If your HDL level is too low, lifestyle changes may help. These changes may also help prevent other diseases and make you feel better overall. There are 5 main lifestyle changes to consider. Eat a healthy diet To raise your HDL level, you need to eat good fats instead of bad fats. This means limiting saturated fats, which include full fat milk and cheese, high fat meats like sausage and bacon, and foods made with butter, lard, and shortening. You should also avoid trans fats, which may be in some margarines, fried foods, and processed foods like baked goods. Instead, eat unsaturated fats, which are found in avocado, vegetable oils like olive oil, and nuts. You should also limit carbohydrates, especially sugar, and try to eat more foods naturally high in fiber, such as oatmeal and beans. Stay at a healthy weight. You can boost your HDL level by losing weight, especially if you have lots of fat around your waist. Exercise. Getting regular exercise can raise your HDL level, as well as lower your LDL. You should try to do 30 minutes of moderate to vigorous aerobic exercise on most, if not all, days. Avoid cigarettes, smoking, and exposure to secondhand smoke can lower your HDL level. If you are a smoker, ask your healthcare provider for help in finding the best way for you to quit. You should also try to avoid secondhand smoke. Limit alcohol. Moderate alcohol may lower your HDL level, although more studies are needed to confirm that. What we do know is that too much alcohol can make you gain weight, and that lowers your HDL level. Some cholesterol medicines, including certain statins, can raise your HDL level. In addition to lowering your LDL level, healthcare providers don't usually prescribe medicines only to raise HDL, but if you have a low HDL and high LDL level, you might need medicine. What else can affect your HDL level? Taking certain medicines can lower HDL levels. In some people, they include beta blockers, a type of blood pressure medicine, anabolic steroids, including testosterone, a male hormone, progestins, which are female hormones that are in some birth control pills, and hormone replacement therapy, and benzodiazepines, sedatives that are often used for anxiety and insomnia. If you are taking one of these, and you have a very low HDL level, ask your provider if you should continue to take them. Diabetes can also lower your HDL level, so that gives you another reason to manage your diabetes. The NASH Facts Project would like to thank Medline Plus from the National Library of Medicine. Medline Plus brings together authoritative health information from the National Library of Medicine, the National Institutes of Health, and other government agencies and health-related organizations. We would also like to thank the NIH, National Heart, Lung, and Blood Institute, or NHLBI. The NHLBI is the nation's leader in the prevention and treatment of heart, lung, blood, and sleep disorders. This was HDL, the good cholesterol explained, from the experts. Thank you for watching. Be sure to like this video and subscribe to our channel for more high quality, thoroughly researched, and medically reviewed content from trusted sources. And check us out on social